Good afternoon, ladies and gentlemen of the bailiwick and beyond, because we hope everybody that needs to listen to this media briefing in relation to COVID is listening. We welcome you. Happy New Year. Now, it is a new year, but sadly, the pandemic is still with us and will be with us for some months, and we have to deal with that situation as it is. Now, there have been little change in relation to the bailiwick provisions recently because there has not needed to be. But let me say this, and I say it so that people cannot misunderstand. Listen to what we have to say. Don't listen to social media. Listen to what we, the Civil Contingencies Authority and its representatives are on this podium today, have to say to you. This is a matter that receives our urgent attention all day, every day. It is the prime concern for us as members of the authority and for those able medical advisors that are assisting us. We do not in any way detract from the urgency and the importance of the situation. Now, the Civil Contingency Authority has met twice this week, one as recently as yesterday, and will meet again next week. And in relation to that, we've had regard to the developments that have taken place in the UK and elsewhere. And at yesterday's meeting, we took the decision, which we announce now, to ban all non-essential travel into the bailiwick. I emphasise that. All non-essential travel into the bailiwick is banned. Dr. Brink will explain what's meant by essential travel in due course. But we're saying to islanders now, and anybody planning a trip into the bailiwick, do not travel unless it is essential. This will be enforceable, and legislation is being drafted as we speak to implement this as soon as is possible. In particular, I want to emphasise that anybody who has friends or family planning to visit them here in the bailiwick, they cannot do so. They must not do so. And although they will normally be welcome, they're not welcome at the moment for the reasons that are self-evident. Anybody coming here purely for work who is not a critical worker should not come. They are not welcome at the moment. We will welcome them as soon as the pandemic has passed and soon as the matter can be given further consideration. I also emphasise this ban on non-essential travel is in addition to, not instead of, our existing travel restrictions. Now, I'm just going to read those. I don't normally read things out verbatim, but I'm going to do that just at the moment. Even for essential travel, it remains the case that all arrivals must self-isolate. Those coming from the UK or any Category 4 country must do so for 21 days or until they receive a negative result from a day 13 test. Those choosing to self-isolate with a traveller must do the same. And self-isolation means exactly that, self-isolation. There must be no halfway measures, and anybody who breaches those self-isolation measures will be prosecuted and will undoubtedly be subjected, if convicted, to a very heavy fine. Now, if you're unclear on any of that, or indeed anything, there's information available on our website, which is gov.gg/coronavirus, and that's been updated in the past few minutes. You can also call our non-clinical helpline on 717-118. I repeat that, 717-118. Now, we considered whether it was genuinely necessary. Indeed, we discussed it on Monday and we discussed it again yesterday, whether we should make non-essential travel banned, and that's the decision, as I say, that we've taken. And we've unequivocally took that decision in the light of the changing circumstances. And therefore, that is operative now in good common sense and will follow with legislation very soon. We feel that the tougher restrictions on our side of the channel provides a degree of additional security and assurance by further reducing the risk of importing cases of COVID-19. So I repeat, and I emphasise, and I make no apology for repeating it, do not travel unless it's absolutely essential. We will keep a very close eye on all developments. We've done that in the past, we're doing it now, and we'll do it in the future. So even if we see little change, we will be holding these press briefings every second Friday. But, and I emphasise, if there needs to be a press briefing in between, and if we need to give further information, then that will be done so very promptly. We will make decisions promptly. We've done so to date. Other jurisdictions are catching up in relation to what we've done, but we're going to be ever vigilant and we're going to be ever careful of the changing circumstances as they undoubtedly will elsewhere. But we're not going to call additional briefings just for the sake of it. We're not going to be pressured by social media comments, and we ask those who are commenting on the social media, in some cases irresponsibly and stirring up unease, not to do so. It is not responsible. We are responsible. We'll continue to be responsible. Our COVID response, the timing of the decisions has always been led by evidence, and I stress that word, and not by political points of view. Now, the panel with me today will look at the particular developments in the rollout of our vaccination programme, which has continued since our last briefing. And I pass over to the President of Health and Social Care, Deputy Bright.
Thank you, Peter. Good afternoon. Last week saw the announcement from the Medicines and Healthcare Products Regulatory Agency, the MHRA, that the AstraZeneca vaccine had been authorised for use in the UK. Following that announcement, the local Medicines Committee met and made a recommendation to the Committee for Health and Social Care that AstraZeneca vaccine be designated for use locally. These recommendations from our Medicines Committee were shared with the Policy and Resources Committee, as well as with SARC and Alderney, with whom Health and Social Care has a duty to consult with before designating a vaccine. This was all completed in a matter of days, with the regulation coming into force on Wednesday, 2 days ago, thus enabling the bailiwick to benefit from the new AstraZeneca vaccine very quickly. We have been clear throughout that there is a need to prioritise the allocation of vaccines in a way which protects our healthcare system and protects those most at risk of the adverse effects of COVID-19. I'm delighted that we have already seen over 960 healthcare workers receive the first dose of the vaccine. The rollout of their second dose started yesterday. I and the team look forward to the expansion of the programme and have just this week received 4,875 doses of the Pfizer-BioNTech and 500 doses of the AstraZeneca vaccine, and Dr. Brink will expand on the plans further. Understandably, we are already receiving a number of requests to consider prioritising other cohorts in our community. We appreciate that many islanders want the vaccine as quickly as possible, which we welcome. But we have to continue to work as a community and follow the evidence and advice available. The work of the UK's Joint Committee on Vaccination and Immunisation has established a clear schedule of how cohorts should be sequenced, based on risk, and in that light, taking into account clinical, legal and ethical reasons, we are following this locally. We have also received a number of requests from non-Guernsey residents to receive the vaccine while they are with us in the bailiwick. We are allocated a share of the vaccine based on our resident population, and therefore we cannot provide vaccines to those who have chosen to temporarily live with us or are here to care for a loved one during the pandemic. For the same reasons, the vaccine is not available privately here in the UK or in other Crown dependencies. Like very many vaccines, both the Pfizer-BioNTech and the AstraZeneca vaccine require 2 doses to be administered. There are questions internationally in respect of the timing of the second dose, with all governments needing to give consideration as to how data from the clinical trials can be applied in their particular circumstances, noting all jurisdictions face different challenges in respect of the prevalence of the virus in their population, and also their capacity to administer a large-scale vaccination programme and the reliability and timing of vaccine supply. All governments need to use the science available to make the decision that is right for their community, and that's what we're doing locally. As with everything else in our response, we'll be driven by evidence, and the staff have been working hard over the course of this week to assess the data and apply it to the bailiwick context. We'll be making a decision early next week, and we'll communicate this as soon as possible. I'm pleased that the next phase of the vaccine programme will be started across the bailiwick next week, and Dr. Brink will provide an update on the number of vaccines and type we have already received, and also what the future delivery schedule looks like and how many islands we are anticipating vaccinating before the end of February. Please bear in mind that any delivery of the vaccine might be delayed by weather, transport and supply issues, which of course are out of our control. Paul will update you more on the Community Vaccination Centre, but I can confirm that it's scheduled to open on the 25th of January. As I mentioned before, please do not call to find out when your offer of the vaccine is. Each cohort will receive written correspondence ahead of each particular phase. While this is all very exciting with the rollout of the vaccine, which is a significant milestone in the bailiwick's fight against COVID-19, we must not be complacent. This is a very tough and pernicious virus, and we have all seen how it can change. We all have a duty of care in how we individually and collectively work to protect islanders and livelihoods. The vaccination is not compulsory. It is entirely voluntary, and if you are offered the vaccine, you must make a decision on whether to have it or not. Whilst information on vaccines is available on the coronavirus website, you may also wish to speak to a health professional before you make any final decision. Please make sure, if you are looking for information on the internet, that you are using a reputable source of information. Again, a link to an independent source of information about vaccines is on the state's website. The advice from your government is to be vaccinated. As always, I would like to thank everyone involved in the rollout of our vaccination programme as we all work together to protect our community. Over to Dr. Brink.
Thank you. So thank you and Happy New Year to everyone, and thank you so much for all the hard work over the Christmas period. I'm going to give you a brief update of our current situation, but also give you some data on our most recent cases that we've seen, our border testing policy, and then of course focus on the vaccination programme. So it's a bit of a general update. So as we speak today, we have 5 active cases. Most of our cases have recovered. What I do want to say is that we have seen the new UK variant virus in Guernsey, and that's been really important. So we, as part of our surveillance, we have a look at the isolates that we get in Guernsey, and we sent some to the UK for genetic sequencing. So what we can do with our diagnostic tests, we can tell people whether they've got COVID-19 or not. We sent some of our samples to the UK to specifically look whether we had the new variant virus, the UK variant virus in Guernsey, and one of the isolates indeed confirmed that. Now, the important thing is that person, we're very pleased to say, has made a full recovery, but was isolating as a household bubble and did transmit to all of their household contacts. So really important, but also emphasises the enhanced transmissibility of the new variant that has been described in the UK. So that's by way of an update of our current clinical situation. What we've also been interested in is what the impact of the general non-pharmaceutical interventions, so the hand washing, the catch it, bin it, kill it, the stay at home if you're unwell, what the impact has been on the health and well-being of islanders over the last few months. And what's really interesting is you can see from that graph, we've looked at 2 things. The first is the number of calls to our helpline, to our clinical helpline, and the second, which I'll show you in a moment, is the number of clinical cases of respiratory tract illnesses that we've had. And what you see from October is a declining number of cases that we've seen calling our clinical helpline reporting respiratory virus symptoms. What's really interesting, because as you all know, I do love evidence, and so I went back and looked at our testing data. Now this shows our testing data, and if you see the bulge towards the right-hand side of the graph, that reflects those increased numbers that we saw in October, which in fact we know weren't COVID-related, but related to another respiratory tract infection. But what you see then is the cases that we're reporting and testing clinically, you're seeing a decline over the winter period. Now, that might be due to less respiratory virus activity in the island, but I think also the impact of the islanders' winter preparedness and adherence to the public health messages must certainly have played a role. Now, interestingly, out of all of the cases we've tested, we've had no flu isolates at all in December. And I'd usually start to see flu isolates towards the end of December going into January. So no reason for complacency. If you haven't had your flu vaccine, there's still time, but really important that we continue to heed that message, because we can certainly see the impact of that clinically. So the other thing I wanted to focus on, and I know I've had a lot of questions on this, is that of border testing. And as you are aware, up to the 20th of December, the border testing, the day 13 testing, was in fact voluntary. And towards the latter part of December, we introduced legislation where you either isolated for 21 days or else you had a day 13 test for release. What we can see is prior to us introducing the new guidance, about 82% of people took up the day 13 test. Now that's in contrast to since the 21st of December, when you either isolate for 21 days or have a day 13 test, we've had 99.6% of people take up the day 13 test, with only 2 people opting to isolate for the full 21 days. So I think that's really interesting. I also thought you might be interested in an analysis of our last cases. So I've looked at our last 26 cases and where they were diagnosed. Now, the first important thing is that we have absolutely no evidence of community seeding. So all of these cases were either through our border testing policies or through our contact tracing and isolation of contacts. So we have 15 day 1 test positives, and we have a further 4 people who became symptomatic between day 1 and day 13. So as part of the messaging we give to people is if they do become symptomatic, we do need to know about it, and what we usually do is send a team round to their home and sample them in their home and find out if they're positive. And in fact, we detected 4 cases that way. Interestingly, we've also had 3 day 13 case positives over the period of time I looked at. Now, that's important because we know that the chance of a late presenter is relatively low, but in a community such as ours, where we have no evidence of community seeding whatsoever, we're talking about a low probability but a high impact situation, because if one of those cases escaped out into the community, it could reseed our community. So really important. And 4 cases were through contact of cases, so there were people that we specifically identified as of interest and at risk, and we diagnosed 4 infections. So we've had absolutely no cases that we've diagnosed within the community, unexpected cases, and that's really important as we move forward. So I think the other thing we wanted to highlight, or I wanted to highlight today, was the COVID-19 vaccination program. So really exciting news with the licensing of or designation of the AstraZeneca vaccine for us, and particular relevance for us living in a small island community, because it means that we can transport the vaccine across to Alderney and Sark. And both islands, I have to thank both of them, have been really engaged in the whole process. Now, just to remind you all, the things we look at, we don't just automatically designate it. We look at whether the vaccine is safe. We look at the efficacy data. We also have looked at rolling out our own staff training program and protocols to ensure our staff are familiar with not only the Pfizer-BioNTech vaccine, which we've already been delivering, but also the AstraZeneca vaccine. We've also been looking at the infrastructure to both procure the vaccine and bring it on island, but also to deliver the vaccine as well. And just to remind you, we're using multiple sites here. So not only are we using our small vaccination hub in the Princess Elizabeth Hospital, but the community vaccination centre will be activated shortly, and I'll come back to that in a moment. But we're also delivering through primary care. So, for example, the over 80s and the care and residential homes are going to be delivered through our primary care services. So again, we've used our Guernsey Together approach of looking at all of our resources to see how we can most effectively deliver the programme. So the vaccine cohorts you're all familiar with. I'm not going to go into them in detail other than to remind everyone that it's an age-based risk stratification, starting with the care and residential homes and health and care workers to protect the resilience of the services, down through the various ages, but also in Category 4 and Category 6, looking at clinically vulnerable groups. And as Deputy Fairbrush and Deputy Broward said, we do have a lot of queries from people wanting to be moved higher up the priority list. And I always say to people, for everyone we move up the list, someone else moves down. And the risk stratification has been done on the analysis of large numbers of patient records to look at who would benefit most from the vaccination. And just to remind you, the prime aim of the programme at this stage is to prevent COVID-associated morbidity, so death, and morbidity, so severe illness, and mortality death. So that's really important. We will get data on transmissibility, but we just don't have that data at the moment. So this then shows a timeline of where we want to be. So we started with the delivery of the first lot of vaccine on the 16th of, the first dose of vaccine we received on the 16th. We delivered it on the 17th to the first islander. And that cohort of individuals are getting their second dose as we speak, so they're currently being vaccinated in our satellite centre within the Princess Elizabeth Hospital. So that's happening at the moment. From next week, the care and residential homes will start getting vaccination. So some of the staff have already been vaccinated. So the remainder of the staff, together with the residents in the care and residential homes, will be vaccinated from next week. And that will be followed by the over 80s the following week. So those are the care and residential homes, the over 80s delivered by primary care. On the 25th of January, a community vaccination centre at Beausejour will open. And the first group to be prioritised, and that is the over 75s. And that programme, the first tranche of the programme that we've mapped out, is to the end of March. And looking at the vaccine delivery between now and the end of March, and I have to emphasise, as Deputy Broward said, this is subject to the continued supply coming in. So we're mapping on what we've been told to expect to deliver, is that we should get about 18,500 doses of the Pfizer-BioNTech vaccine and just over 22,000 of the AstraZeneca vaccine. So we're planning by the end of March to try to deliver about 40,000 doses of vaccine. So really a huge effort. And again, what I'd like to do is thank everyone, all the volunteers that have come forward to help us deliver what is the largest vaccination program the Bailiwick has ever seen. So we've also taken specific note of the requirements of Alderney and Sark, and this is particularly important. So we ordered our first dose of the AstraZeneca vaccine on Monday this week, which was the earliest opportunity that we could to order the vaccine. And of the 500 doses, we prioritised 375 of those doses to go to Alderney and Sark. So 300 will go to Alderney and 75 will go to Sark. So really important that we specifically take the needs of islanders in Alderney and Sark into consideration. What's good about the AstraZeneca vaccine is we can transport it across in our normal way that we transport vaccines across to the islands. So really encouraging from that point of view. And they will be starting their programs imminently, and I'm sure they will provide more information on that. The final thing I wanted to do was pay testament to our students over the Christmas period. They have behaved magnificently. They've come back. A lot of them have had extremely difficult experiences in their first term of the academic year in the UK. They came back, they self-isolated, they adhered to the policies, they behaved responsibly, and I think we owe a huge debt of gratitude to them, and I think we should note the contribution that they've made to keeping the island safe. So thank you to all of the returning students. We're really grateful. And we're also really grateful for the interactions we've had with you through public health services. You've been courteous, you've been helpful, and you've tried to make our lives as easy as possible. So a big thank you to our returning students, but also to the wider Bailiwick when you look at our respiratory symptom figures for the whole of the last 2 months. So thank you.
Thank you very much, Dr. Brink, and I agree with all those points. Well said. Paul.
Thank you and good afternoon. As those on the panel have already mentioned, our focus is twofold: maintaining our current positive position and rolling out a vaccination programme. The rollout of the vaccination will be all the quicker and more efficient if we maintain our current positive position, and in doing so without social distancing requirements, full protective clothing and equipment. We understand how difficult and frustrating the ongoing COVID situation is, but please remember why we need to be vigilant and how lucky we are to enjoy our relative freedoms and safety in the Bailiwick, but how fragile this situation could be. We have seen elsewhere how quickly circumstance can change, and we encourage all businesses, as we are in the public sector, to learn from 2020 and consider your business continuity plans should we be in a position where we need to act quickly and move to a high level of restriction in the Bailiwick. Further and more stringent controls on our borders are of course intended to protect us from any outbreak of COVID-19 that requires second lockdown to prevent putting the health and lives of islanders at risk. The approval of both vaccines offers us a beacon of light at the end of the tunnel, and it's only natural that many of you are keen to know when you'll be called for your vaccination or to ensure that your vulnerable loved ones are vaccinated promptly. We too are very keen that we continue with our organised, efficient rollout of the programme. We are well into the delivery phase of our vaccination programme. As mentioned already today, the first phase of the vaccination rollout has proceeded so far without hitch and is ongoing. We will be contacting the prioritised cohorts of bailiwick residents by letter to invite them to book an appointment for their COVID-19 vaccine. The first batch of letters will be out on around the 14th of January. Please do not call the non-clinical health line or public health services to see when you receive a letter. You will receive one if you have been prioritised. You may wonder why your neighbour or best friend hasn't had one. Please have faith. We are using information, as said by Dr. Bring, from our primary care colleagues who know you, know how old you are, and know if you meet one of the priority groups. As mentioned by Deputy Briard, we are planning to begin our community vaccination centre at Beausejour from January the 25th. Commencing with the over 75s group, the opening of the centre will help us get through as many groups as we can and as quickly as possible. We have had some requests to release daily updates on the numbers of vaccinated in the same way as we currently release other COVID-19 statistics. This is infeasible to do so accurately, given that some of the vaccinations will be administered in GP surgeries by our primary care colleagues. We look, however, at the possibility of releasing vaccination figures weekly so that the community can keep up to date with our progress. Our stance of being absolutely transparent has not changed, just as it has been maintained throughout the pandemic. One of the significant implications of the UK government decision to enter national lockdown was the impact on exams, which naturally has implications for our students too, as they sit the same exams as their peers in England and other parts of the United Kingdom. I know the Committee for Education, Sports and Culture and colleagues in education are engaging with the UK exams regulator and are awaiting definitive guidance from exam boards on how qualifications will be awarded this year. Of course, we have been here before with students last year facing the same level of uncertainty, and we all want to give young people and their families certainty as soon as possible so we can be assured as soon as further information and guidance comes through that we will make it and make sure we communicate to you all. What we can say at this stage is that where formal examinations are not possible, the expertise of staff in schools and the College of Further Education demonstrated last year that teacher assessments can be used successfully. If necessary, we will follow the UK regulated process, as it would be impossible to carry out and facilitate variant assessments for over 300 courses. We know that as situations around us unfold, it can be really unsettling, so please continue to support each other just as you have been. The spirit of Guernsey together served us so well, and it's exactly the spirit that will help us get through to the next stage.
Thank you very much, Paul. Ladies and gentlemen of the press, it's your turn. As I say, we'll be back here in a fortnight. We'll be back here before if we need to be. But it's now your chance to ask questions of us on the panel, and we'll do our best to answer any reasonable questions. So who'd like to start first? Yes, sir.
Matthew Leach, the Bailiwick Express. Happy New Year.
Thank you.
Following the news of the approval of a third vaccine in the UK, the Moderna vaccine, what do we know about this?
Dr. Brick.
Sorry. Sorry. So my understanding is that this vaccine won't be available in the UK until the late springtime, but we're waiting further confirmation. But we'd expect to receive a proportionate allocation of that vaccine. It is, of course, a messenger RNA vaccine. Its temperature requirements are slightly less extreme than the Pfizer-BioNTech vaccine, in that, to my recollections, it's -20, so it'll be slightly easier to deliver from that perspective. But we'll probably still look at using that within Guernsey and continue sending the AstraZeneca vaccine out to Alderney and Sark. So we don't have any further information other than that.
Thank you. Very good perceptive question to start with. Well done. I'm sure the standard will be maintained. Your opportunity so to do.
Hamish Alscoe from ITV Channel. I wonder, given the increased transmissibility of this new strain in the UK, whether or not there's been discussions over changing the rules over people self-isolating in shared housing, where the rules state that if you can't stay in your room for an ensuite or for food, you can go into shared areas. Is there a concern that could lead to potential breakout of a case?
Dr. Brick.
So, yes, it is something that we've actively considered through our contact tracing protocols, and we have modified those slightly, and we've put enhanced testing under those circumstances. So you're absolutely right. We need to focus really carefully on the enhanced transmissibility. Report as anything between 40 and 70%. So we've put additional testing steps. We've put additional advice for people who are sharing together about cleaning areas, but also we are strongly advising people to try and self-isolate completely separately. So simple advice, for example, is if you don't have a dishwasher, think about using disposable plates. So those type of bits of advice we are rolling out. But I think it is an area that we need to be increasingly vigilant, and especially vigilant, particularly with the new variant.
Next question, please.
Ewan Duncan from BBC Guernsey. Happy New Year to you all. Dr. Brink, you mentioned that the priority list is based on age, and Deputy Brewer has mentioned about the health requirements, and obviously you know about that. But judging from yesterday, where we saw Condor having to remain in Guernsey for many hours and after some of their crew tested positive, should we be looking, Condor obviously have a UK crew, but should we be looking to our crews in the bailiwick for Aurigny, for example, to perhaps prioritise them, seeing as they are probably more likely to come into contact with anyone with coronavirus?
Just before Dr. Brink answers that, just you mentioned the Condor situation. Can I just pay credit and give praise to the way that that our authorities here, our staff here, reacted to something that could have potentially been very concerning indeed. It was dealt with promptly, efficiently, in a common sense and pragmatic manner. Over to you, Dr. Brink.
So thank you very much. Again, it is something that we've given due consideration to. But as ever, if we move one group up, we move another group down. If one had an unlimited supplies of vaccine, you might make different decisions. But we have a specific allocated amount of vaccine, and we have made the decision to use it in line with the JCVI recommendations. And in fact, the designation of the vaccine means that we need to adhere to those JCVI recommendations. Having said that, it's not that we shouldn't focus on those groups of individuals. So, for example, we've recently changed the PPE that people interacting with Condor ferries, and indeed the airline crew working on Aurigny, we've recently changed the PPE they're required to wear. And for example, for the cabin crew on Aurigny, we now are using long-sleeved aprons together with visors, masks and gloves. Now, the reason why I wanted the long-sleeved aprons, if you think of how an aeroplane, you walk up and down the aisle and you can easily brush onto surfaces and so on. So it provides them that additional protection. So we are very cognizant that we also have testing strategies behind those groups of individuals, but we have to maintain those JCVI priority groups, because that is how the risk assessment is done. And as I said, if we move one up, we displace some other people down who are being proven to be at a higher risk.
Will groups like that be at the top of the bottom priority list, if you like?
So if you go all the way down to priority group 9, that is your over 50s. And there is a lot of talk, and that forms the end of your phase 1 of your immunisation programme. There's a lot of talk about phase 2 of an immunisation programme, and certainly those groups would be considered in that group. But it depends on vaccine supply. So at the moment, we're in a sense a bit of an unknown, that we don't know how secure, how long the vaccine supply will be, and also we don't know about the impact of the vaccine on transmissibility as well. So there are a few unanswered questions. So in the interim, we've used PPE, we've used enhanced testing, but we are always looking at policies and procedures, but at the moment are going with JCVI guidelines.
Okay, next question, please.
Helen Bowditch from the Guernsey Press. My question is just a clarification, really, because I think everyone wants to sort of know when they're going to get their jab, and I know that's a really difficult question to answer, but I think I scribbled down quickly. You were saying next week is care home residents, the rest of care home staff over 80s, and then from the 25th of January, the over 75 start here at Beauséjour, and then you said end of March. I'm not sure if you said you were receiving you'd have received 40,000 doses, or if you had expected to administer 40,000 doses. And who is that? Is that everyone above 50 or 60, or what groups is that?
Yeah. So to answer your first question, it's to have administered in the region of 40,000 doses of vaccine. So that will depend on the security of the supply. So that's on our predicted schedule. So we've been given a predicted delivery schedule till the end of March. So we're mapping out our immunisation based on that predicted schedule. And that will allow for in the region of 40,000 doses of vaccine. We've modelled our delivery on our ability to deliver those numbers. So, for example, we know that when we open the community vaccination centre, if we have sufficient vaccine, we can deliver in the region of well over 3,000 vaccines a day there. So we've looked at all of that. So with regard to exactly what priority group we're looking would get to, which I think was the second part of your question, is what we're looking at in detail is the spacing of that second dose of vaccine. So what is the optimal spacing time? And so that'll, the dilemma for us is, do we get as many people as possible the first vaccine, or do we deliver everyone 2 doses of vaccine, and what time gap we use between the first and the second doses of vaccine. So that is something that we're looking at in great detail. We will not be going beyond 10 weeks. The reason why we won't go beyond 10 weeks is that if you then have delivery supplies, bad weather and so on, we don't get vaccine on the island, we need to have that safety buffer for us. So we would be very reluctant to go beyond 10 weeks in our delivery schedule.
I think Deputy Bride covered it. Actually, in the island at the moment are about just under 6,000, I think, doses of vaccine. That's what we actually got physically in the bailiwick at the moment. And I just make the point in relation to, as Dr. Brink said, just look at the essence of what we're asking people to do, what we're asking Dr. Brink and the other people to do in relation to the vaccination process. 40,000 vaccines between now and the end of March is the equivalent of 40 million in the UK. And I don't think that's what they're predicting they're going to be doing by the end of March. Next question, please. Yes, sir.
The UK has introduced a negative test requirement for travel into. Do we know why the Channel Islands are exempt from this?
Well, we're classed as domestic. This is classed, a flight from Southampton to Guernsey is classed as a domestic flight. That's the reason. We're not an international. We're not deemed to be international under their regime.
Question again for Dr. Brink. If the testing and isolation arrangements, and you've talked us through the chart already and how we're catching those cases on day 13 now, if we think that they are robust, then why have we changed the travel restrictions to make it only essential travel if we can be sure that the system is working?
Because that's in the light, I mean, I'll ask Dr. Brink if she wants to comment further, but that's in the light of what's happening around us. It's another weapon in our armoury. We're convinced that the regime that is in force is a good regime, but if anything can happen to strengthen it, that is what we will do. And that's the point we're making. If anything else, there might be something that arises tomorrow, I don't know what, because it hasn't risen yet. Then we'll look at it and consider it and make a decision based upon it. Do you want to add anything?
I think the other advantage we have is we're delivering the biggest mass vaccination programme we've ever done in the absence of community seeding. So we don't have to have our staff in PPE. We're not donning and doffing PPE, so we can vaccinate very efficiently. So really, while we're in the process of trying to get our population immune, it makes sense to be as safe as we can so we can roll out that programme with as few restrictions as possible.
Thank you. Next question. Yes, sir.
Deputy February, you mentioned in your opening speech that you have found it frustrating perhaps that people on social media have been calling for more frequent briefings. One of the people who have been strongly calling for that is your predecessor, Deputy St Pierre. Do you find his comments unhelpful to your management of this situation?
Well, I'm not going to personalise it. I would ask all people, whether they are politicians, ex-politicians, whatever position they hold in our community, to be responsible. We are people that are committed to ensuring that you, the media, and the bailiwick at large have all the information. But we're not just going to have a meeting because we're pressured to have a meeting. If we believe in another meeting, we're having one today. If something happens this afternoon or this evening, and we believe there should be another briefing tomorrow, we'll have one. But other than that, we'll have our briefings every 2 weeks.
If I could also add, Deputy February, I think it's a really important point. We don't stand in judgment of other jurisdictions, but we've seen the plethora of information and the confusion of information in many jurisdictions, and we've set out to provide transparent information. We don't always know the right answers. We work at them, we base it on evidence, but we've said that what we would do is set a very standard rhythm, which is every 2 weeks, so our community know those briefings are coming. And also, if we call one in between, you know it's essential that we've got to do that additional briefing.
Yes, yeah, then Helen after, but you first.
Sorry.
No, yep.
Ferris, with the greatest respect, there's been incidents this week where we've been asking questions of the communication team, trying to get answers for bailiwick residents, which we as journalists that is our role.
Yep.
And we've been told we'll answer those questions at the press conference. And we're asking questions on Monday, and we would like a response, because if we look to our colleagues in Jersey, for instance, they have the answers, and they're saying to us, well, what is the answer in Guernsey? Well, we don't know, and we'd like to be as open and honest with our public, with the people who are tuning to listen to us or read the paper or watch the television. But if we don't have the answers, we can't give it to them.
No, I think that's a fair point. And as Paul has just said, we're going to learn lessons. We'll always do our best to improve. I'm sure we won't always get 10 out of 10, but we do our best. And if we think that, I think we've got a good communications team, but we hear what you say, and I'm sure they'll respond to it accordingly.
Yeah. And if I could add again, and I would be fairly robust on this, the CCA met on Monday to go through a whole suite against a dynamic situation. Even in between that, we knew the situation was changing. The CCA met again at 08:30 on Thursday morning, that's yesterday morning, for an order for the CCA political members to have that information. Staff are working well late into the evenings to get the factual, evidence-based information, not simply just to provide a media brief. We want to provide open, accurate and transparent information, which is why we will stick to that rhythm.
Yeah, and I believe Al will confirm it. He and I and our other political members, we were getting information, up-to-date information at 1 or 2 o'clock in the morning, and considering it 1 or 2 o'clock in the morning.
Yeah, absolutely. And I think what you also have to imagine, whatever we're doing in Guernsey, it seems to be working for Guernsey and the other islands. So I think we've got that part of it right. And I think, I can't stress enough, follow the rhythm of the every 2 weeks meeting. Do not listen to what's happening on some of the social media sites, because it's just scaremongering. And I think we've got a duty as both journalists and as politicians to try and be as open as honest with our islanders and present the information as it comes up in a regular, controlled manner.
Yeah. We've got nothing to hide. We want people to know. Helen.
I mean, I would concur, though, with what my BBC colleague said. I think the communication has gone a little bit awry this week. And I mean, you're having a swipe at people on social media, but sometimes I think their questions are very reasonable. That if they're asking things like how many vaccine doses have been administered in Guernsey, or has the Oxford vaccine arrived in Guernsey, I don't think those are unreasonable questions.
Yeah, but we can't
and
respond.
You don't have to have
we've got limited resources. The main thing is to make sure. The answers are given as properly as they can be. But we're hearing what you're saying, and if the communication should be better, then it will be better. But the information, the main thing is to keep the bailiwick safe, to keep people informed in a proper way. The media was told we were going to have a briefing today. You've had a briefing today, it's been a full briefing today, and you can ask whatever questions you want. If we do need another briefing, as I say, tomorrow, hopefully we won't, or on Monday or on Tuesday, there'll be another briefing on Monday or Tuesday. Can we have the next question, please? Yes, sir.
We just return to the vaccination programme rollout. You talk about the JCVI priority list as if it's very set in stone. It's almost hindering your ability to maybe make different decisions. And given the bailiwick success is partly found in the fact we've been able to do things very differently here, led by you and the CCA, is there any frustration with you that you can't change some of those priority groups and maybe perhaps include Arini staff in there if you so wanted to?
Do you want to deal with it?
Yes, so I actually support the JCVI priority groups. The reason being is it's based on evidence. So they've actually looked at 30 million sets of patient records, and they've stratified the risk of COVID-19, both death and severe disease, based on the assessment of those records. So it is a good evidence-based list, of priority setting, and I think that's reasonable. I think, again, is every time you move someone up, you move someone down, and you're moving people down that you know will suffer more severe consequences. And if I could remind you, in our first wave, the care homes were essentially our front line then. And that's really, really important. So I think looking after and providing the vaccine to those groups that are more likely to have serious morbidity and mortality is absolutely the right thing to do, both medically and ethically. So no, I'm happy with the priority groups as they occur. Having said that, I think it's always good to look at the critical infrastructure. I think once those groups have been immunised, is actually then looking at critical island infrastructure is entirely appropriate for a geographically remote location. So I think that's reasonable to consider, but after those that are most at risk have been immunised.
Dr. Brink, now the UK has changed their system on the frequency they're going to give vaccinations. Are you confident the bailiwick will still have access to enough vaccines that we need? I know you've spoken about this previously and you haven't figured out your timeline for doses, but are you confident we can still hit the 40,000 target?
So we have a predicted vaccination schedule of delivery. So that's what we've been provided with. I'm as confident as I can be, but there always is going to be a risk with regard to something happening to the vaccine supply. We're in a new situation. So I can only work with the schedule that I'm given and map it out accordingly and make sure that we have the resources in place and so on. So I'm an optimist, and I am expecting to receive what is allocated to us, and I'm planning to receive what's allocated to us. But I couldn't look you all in the face and say to you it's tablets of stone, because clearly there's going to be there could be some variability. But I'm hopeful not.
A lot of the schedule seems to be dependent on this idea of when do you deliver the second dose. Are you leaning, I think you said next week you're going to make a decision, but are you leaning in a certain direction on that?
So I think certainly from category 3 we'll look at a longer period of time between the first and second dose. We're looking at all of that evidence together. As I'm sure you're aware with the Pfizer-BioNTech vaccine, World Health Organization has said 6 weeks. That's based on the vaccine trial data for the Pfizer-BioNTech, where they've looked at a time point of 45 days. So I think doing a longer period of time between the first and the second dose of vaccine, certainly when you get to category 3 and beyond, I think is entirely reasonable. We need to model out the risk-benefit of exactly what the best time point is. As I've said before, I'm nervous about going beyond 10 weeks, but that's for logistical reasons. We have a couple of stormy seas and the ship doesn't come in and we don't get our vaccine supply. So it's mainly for logistical reasons that I'll be nervous about going beyond 10 weeks. But that's the situation, or my honest appraisal of it at the moment. But I almost certainly will be looking at longer time periods between the 2 doses of vaccine.
Any other questions, anybody?
Dr. Spring, I was just going to congratulate you for last year and your predictions of how things were going to pan out always seem to come through, and especially when you were looking ahead to the flu vaccine. How pleased have you been that we've managed to stay a relatively flu season down this year? And are there any predictions for 2021 that we need to be thinking about as we move through the year?
Yeah. So one of the positive messages from the pandemic is I'm hoping that we will all reassess the way we run our lives. So not only in the broader mental health and well-being, how we work, how we live, but also how we prevent infectious diseases. And I think there are positive messages to be learned. So interestingly, we've seen very little winter vomiting disease this year. So I think that hand hygiene, that stay at home if you're unwell, is really impacting on the well-being of our population. And that's really important with keeping people at work, keeping children in school, but keeping us generally healthy. So I'm very much going to be, towards the end of this year, nagging again with the same message.
I think I'd just like to thank you for your point, and I don't want to embarrass Dr. Brink, but I don't mind actually embarrassing her. The Deputy Liam McKenna in his recent speech, in his maiden speech to the States, described she could be a deputy, Dr. Brink as an angel sent from heaven, and I think we'd all like to say that. But the next question, please.
Dr. Brink, I wondered if there were particular groups that you would like to see receive particular vaccines, or is it a case that whatever is around?
So there's no evidence to suggest that one dose of one type of vaccine is particularly better for one group or another group. So what we are saying is that people will not be able to choose their vaccine type. It is simply not logistically possible when we're delivering 40,000 odd doses of vaccine to have people to pick and choose, because at the moment, what they are saying, if you have vaccine A for the first dose, you have to have vaccine A for the second dose. Now, there are studies looking at the mixing of the two vaccines. There's a big study going on in Bristol at the moment. But at the moment, if you have vaccine A, you've got to have vaccine A for your second dose of vaccine. You can't mix and match. So to answer your first question, no, there's no evidence that there's a particular vaccine better for a particular group of individuals, and we aren't going to be able to accommodate vaccine choice.
Any other questions? Yes, sir.
Now that the policy is essential travel only, there'll be more and more families and businesses who'll be thinking concerning thoughts about 2021 being a year where perhaps for tourism, for example, will be very difficult to make money. Can you give any message of hope to those people who rely so heavily on the travel for whatever reason between our bailiwick and other areas for hope for this year?
Yeah, I think that's a really good point made in the form of a question. The answer is yes, because the sooner we get this virus under control, the sooner we get these vaccines out, the sooner we and other communities that surround us, where we will travel to and travel from, get confidence and their communities are protected, the earlier that the tourist industry can be opened up, because it is the hospitality sector is such an important sector to our community. Do you want to add anything else?
No, I think Dr. Fairbrush captures it well. I mean, as soon as the world really, and especially the UK part, as soon as they are vaccinated and they are on top of the virus, then we've got a chance to travel between the two and expand. So the sooner we can get on with the vaccination, so much the better.
Anything else? Yes, sir.
Is the message also then not to leave Guernsey? Because I guess if I wanted to go see a family member or whatever, could I just then not get back into Guernsey?
Well, the answer is don't leave Guernsey unless it's essential. I mean, there is a category of essentiality. And for example, people are worried about this. Some university students have gone away. Well, of course they can come back. Absolutely, they can come back. They're bailiwick residents. They can come back as soon as they need to, as soon as they want to. But generally, no, you shouldn't travel unless it is absolutely essential.
Another one for Dr. Brink, sorry. My favourite today. 40,000 vaccines by the end of March on current modelling.
Yeah.
How long do you anticipate for the rest of the bailiwick? So, roughly what, another 30 couple thousand?
So until we get our vaccine schedule for March and beyond, it's impossible for me to answer that question. So the modelling that we're doing to date is on what we've been told we're going to receive. So we've looked at the weekly allocation, we've looked at what's going to be delivered in the hospital, what's going to be delivered by primary care and what by the community vaccination centre, and we're mapping now the staff requirements to do all of that, sitting behind that. So we can only get as far as March, and then we have to see what other vaccines we get delivered, indeed whether we get the Moderna vaccine as well. So we need to then see what else we get delivered. So I really am not avoiding your question, but until I actually...
Who plans out meticulously.
I know. Until I actually get that allocation from April and beyond, it's impossible for me to be precise about that.
But it'll be as soon as it can be.
Yeah.
Obviously, the idea is to get everybody vaccinated that should be vaccinated as soon as possible.
Yeah.
I was just looking at in your criteria for essential travel, one of the things is to undertake essential business that cannot be transacted remotely, and that's distinct from critical work. What sort of thing do you envisage essential business as covering?
I think the point is they'll have to come to, when I say us, I mean Dr. Brink and her team, and say this is essential, and that will then be looked at in relation to whether it really is essential or it's just desirable. There is a difference between the two. I don't think that you could categorise it completely. Is there anything you want to add to that, really?
So an example would be that we need our CT scanner fixed, but it's not urgent that we do it immediately, but there's a part that might need to be looked at in the next 2 or 3 weeks. So that would be the type of thing where we really think that travel's essential to maintain the critical infrastructure of the bailiwick, but and so it's that type of category that we'd look at with that, because obviously if you're an engineer, that work can't be done remotely. But we'd be encouraging people, if they can have a transaction, discussion, meeting remotely, have it remotely.
Anything else? I don't see any hands raised. Thank you very much indeed for all your questions. Thank you very much for listening, everybody. We'll be back in a fortnight or before if necessary.